Hola, buenas tardes. Encantados de estar aquí.
Hello, we're very pleased to be here. We're going to be starting a new session about health and well-being. My name is Pilario Maestro and I am Chief Vertical Business Development Officer. Today we'll be speaking about health and Movistar Health. With me, Mark Spell. He belongs to Teladoc, the partner with whom we have launched this joint venture, Movistar Health. We're thrilled to be here, and we're going to be sharing with you information about why we are here, and we want to tell you a little bit more about our value proposition as well. Mark, so let's start. Why are we here? How did we get developed to develop a service which is oriented towards health and well-being? Well, we all know what we have experienced in the last few months. So today we know that health and well-being is extremely important and has been undermined as a result of the COVID-19 pandemic. More specifically, we all believe that we are undergoing a post-traumatic stress syndrome. According to last year's statistics, approximately 25% of workers have acknowledged experiencing stress, depression, or anxiety episodes as a result of isolation and high stress levels. This has had an impact not only in terms of anxiety, but also a physical impact, sedentarism, and new lifestyles. On average, each Spaniard has gained 6 kilograms as a result of this switch in activity and food patterns, and as a result of that, there are more and more cardiovascular conditions, amongst others. Furthermore, and now to close the loop, rather, Spaniards have experienced a situation in which the socialization model that we are accustomed to has been disrupted. We're having to learn how to interact from scratch. We're experiencing that in our everyday life. Like here and now, today, in the Mobile World Conference, we are back to face-to-face meetings. But of course, all this time that we have not been able to socialize has provoked distortions and disruptions. So we stem from a scenario in which we have experienced physical and emotional impacts, and we need to work on them. But not all these rather negative repercussions. We should also speak about new patterns that the pandemic has pushed forward. In Spain, up to date, the medical system was almost 100% face-to-face. If you wanted to go to the doctor, you have to go all the way there, to the hospital or the health center, and the expectations that as staff members had about companies and their role in healthcare were under what we have today. In the past, 50% of employees considered that companies should have an active role in healthcare, but the majority of us used to think that healthcare was dependent on the state or the private insurances. Today, we are clear that we are all responsible for health and well-being, companies and institutions also. That's why we know that this very relevant change has taken place first because we are moving towards a more virtual medical attention model. Now we are used to interacting differently. First, on the phone, but little by little, our paradigm and patterns have changed, and now we understand differently and interpret differently our relationship with doctors and health professionals. And the good news are that this is possible, and it's possible to manage this new relationship with our healthcare system. Now, regarding workers' expectations, before I already mentioned that in the past only 50% of workers consider that companies were in charge of health and well-being. Now, after the pandemic or during the pandemic, 70% of workers consider that companies has the obligation of taking care of their health and well-being. So today, companies have this must. So much so that during 2020, many CEOs, presidents, and directors consider health and well-being priority number one. It's very high in their agenda, so we cannot consider a company without a health program or a focus on workers' health. How can technology help us in this endeavor? We are in a domain where technology is very important, and us, as Telefónica, we aim at digitizing processes and help our customers digitize their ways of interacting with their workers and society as a whole. That's why we have carried out an assessment about what can technology do for us in this new environment, in this new scenario. So how can technology help us improve the theaters of the face-to-face model? In face-to-face models, well, it takes much longer, right? A face-to-face meeting or any face-to-face interaction requires of much more time than a virtual meeting. Of course, remote working, online shopping are only two examples of how much time we can buy when we do things digitally. What happens when we are face to face? Well, basically that the systems end up being collapsed, especially in the context of the COVID-19, and presentiality contributes to putting a burden on health systems, waiting lists for many health specialities. Many specialists can work with their patients digitally and thus contribute to a shortening of waiting lists. Not to speak about the need to move physically to meetings and different places, right? Moving around when you're working takes a lot of time. When you're working at home and when you're working in your office, oftentimes when you need to go to the doctor, you need to go all the way to a hospital or the health center. And this time, oftentimes, is much longer than the time you are dealing with a doctor. In a big city, you need to spend at least 30 or 40 minutes to go to the health center with the environmental impact that this has. It's much less efficient from an environmental perspective, and it emits CO2 emissions. So digitization have positive sides, right? Many processes can be digitized, and thus we can save time and resources. Not to speak about waiting rooms. We've all have spent hours and hours in waiting rooms. Offer and demand are not always coordinated, and oftentimes we need to spend time waiting in a waiting room. And perhaps you only have a little doubt and you end up waiting up to 4 or 5 hours on average, depending on the doctor you're visiting or depending on which hospital you are attending for very short consultations. Let's imagine saving all this time and and managing digitally whatever is possible to be managed digitally. Up to now, we were not so much aware about infection risk, right? But now COVID-19 has put that on the table. Today we know that we need to avoid propagation of viruses. Today we all feel responsible about preserving others' health. So all the percentage of visits to doctors that can be reduced thanks to digitization are going to help also cut coronavirus propagation and other viruses. Now, in these last few months, we have experienced an acceleration in the digitization process. This acceleration is today a reality and has reached almost all sectors. Actually, many analysts consider that in terms of digitization in the last year, we have moved forward 5 years. So digitization is rampant. Some sectors were already in a very high-speed digitization process, such as online shopping. Online shopping has been interiorized by most people, right? But in the last few months, the percentage of online shopping has increased by 36%, and this means that many of us that used to shop online sporadically or perhaps only, for only for certain products, it was not included in our shopping patterns, in our shopping habits. Today, it has become a habit, so there's no way back. The increase in the online shopping share will probably not decrease, but rather stabilize and keep growing. Not to speak about remote working. Today we have around 4 million people remote working in Spain. In the last year, 90% of workers were working physically. Today, Mark and I were discussing about that. There will be a share of remote work. The process has gone widespread and mainstream, and the relationship and everything is changing. Not to speak about e-payment methods. Now, everyone says, oh, I never carry cash on me. And when you are asked to pay something cash, it's like a nightmare. We want to pay everything remotely. We're not using cash. Actually, 22% of users never use cash. So this is a change in human pattern, a quite significant change in human patterns. Many ATMs go unused for even 2 weeks in a row. So I could list many different examples. I just wanted to share a few because they are very illustrative of the reality we are experiencing. Also, there are some sectors which were perhaps not so much digitized, but now they are in the process, such as education. Education is in a forced digitization process as a result of the pandemic, and today we're going to be speaking about health and well-being. Health has had to go digital very quickly to be able to respond to users' needs, and that's why we are here. We want to be here to ensure that digitization is solid, and companies have also a key role to play in health and well-being. And I'm going to hand it over to Mark because from Telefónica we have signed an agreement, a very strong partnership with Telaro Health, and we have merged our technological capacities with their medical capacities. Mark, the floor is yours. Thank you very much, Pilar, for your kind presentation. As Pilar was telling you, in this context, Telefónica saw the opportunity of digitizing health, so promoting e-health services, and that's why we decided to merge, to sign this partnership. So probably all of you are aware or know Telefónica. Of course, you all know Telefónica and Movistar, but probably you have not heard from us. You have not heard from Teladoc, and that's why I'm going to briefly introduce the company. We are the world leading e-medicine company. We are listed in the New York Stock Exchange market with more than 4,000 employees scattered around the world with more than 20 years of experience in the sector. By that, I mean that we started in remote medicine or e-medicine when that meant only phone calls, right? When digitization was not a reality. So in the last 20 years, we have put together a network of 50,000 doctors and health professionals around the world. So we are present in Spain, but also globally. We are the leading company in e-medicine, high-quality e-medicine. So if we move to the following point, I would like to tell you a little bit more about our local experience. Let me also underline that within the Spanish market, Teladoc has a very long experience, more than 20 years. In the past, we had another company that was absorbed by Teladoc. So we've been working since 1989 in the sector, in the field. I believe it's very important to underline this point, right? Because we are an international company based in New York and with a worldwide expansion, but with a solid basis in Spain. Actually, the international headquarters is in Barcelona, in Spain. So that's why all doctors that provide services in Movistar Salud, we will tell you more about how the service works. So all doctors providing services are based in Spain, hold their BA in medicine from a Spanish university. So this is part of the unique experience that we believe to contribute to. Now, when it comes to technology, Teladoc has excellent health services, e-health services. But again, we're a telemedicine company, so we have a technological side, and we believe that Telefónica will for sure contribute a great deal and provide an amazing added value so that we can develop our own platforms and fine-tune the existing ones to provide e-medicine services. Before telling you a little bit more about the solution that we want to introduce, we would like to share first a short clip. Thank you.
Te damos la bienvenida.
Welcome to Movistar Salud, the platform providing innovative health services from home. Movistar Salud offers you a very easy-to-use platform, 100% secure, that puts at your disposal high-quality holistic medicine services wherever you are. You will be able to have access to family doctors 24/7, and also you will have access to professionals from different medical specializations. Your health will be always under control. You'll be able to get in touch with your doctor at all times. Movistar Salud, the future of health today. So this short clip has some key messages. One, total availability, 24/7, 365 days a year. We live in a world where everything has to be online today, now. When we buy something, you receive it 10 minutes after. We want to go somewhere and we can buy the ticket to that destination before we even decide where we're traveling. So the same applies to medicine. Medicine needs to be available 24/7, 336 years a year, and wherever you are, right? The wherever you are is very important. You can be wherever you please. You can be in a rural area in the case of the product that we're going to be showing. Any employer working anywhere in the world can have quick access to the service. It's a multi-platform service. As it has been said before, we have our own tech platform, which is accessible both in a web or app and tablet format, so it's very easy to access. That's a very important point. Safe and confidential, secure and confidential, sorry. All our services are under the umbrella of the Data Protection Act. And as you know, health data are highly confidential. So whenever the service is downloaded, employers might know how or what consumption has been done of the service, but no one will ever share personal data. No one will have access to personal data, of course. No one should worry about whether employers are going to have access to the use of the service. It's 100% confidential. There's another important point that I would like to underline. Online prescriptions. All our doctors are entitled to issue online prescriptions in case the doctor so considers after a diagnosis process, and the online prescription system includes an agreement with all drugstores in Spain. So all our doctors, when they issue a prescription, or they issue an e-prescription almost instantaneously, so that patients can attend any drugstore in the country and pick up the medication without any paper involved. There's another important point, which is no limit in consultations. It's not only that the service is 24/7, 365, but also that there is no limit to the amount of consultations. It's 100% free. Also, beyond the online prescription system, so they can carry out a very quick diagnosis. Mark talked about the main features of the service, and now we would like to tell you a little bit more about the service itself, about the different components of the service. The service is composed or designed from a health attention interpretation with 3 solutions. The first one has to do with the medical consultation, the first or the primary healthcare attention, which gives access to users to family doctors 24/7, 365 days a year whenever one experiences a health request or need. Considering that we are speaking about a digital service that can be required very easily through the application or by agreeing on a online video call. Of course, it is an extremely comfortable service, easy to use, ready to use. Imagine you're experiencing a very strong headache or any other medical need. So you can go online, open the application, and probably in less than an hour, a doctor will be calling you at home without having to go all the way to the hospital to see how they can help you. This would be the first thing. Then there are medical specialities. We have a long list of specialists, trauma, rheumatology, amongst many other, and of course, these will provide you access to specialist doctors through video calls in order to exchange any doubts, needs, or share symptoms related to a specialty. Let's think about pediatric health. Oftentimes, as parents go to specialists to share our concerns. So we spend a lot of time going all the way to the hospital or the healthcare service. And the third element, because of course, from Telefónica, we believe in big data and artificial intelligence. So, of course, we need a tool, a pre-assessment tool with a search engine fed by artificial intelligence. The tool compares with more than 660 conditions, and in a very quick way, in 4 or 5 minutes, when the symptoms are introduced in the platform, the tool provides you with the first tips about your symptoms so that you can have a clear understanding about the next steps. Say you have a terrible headache, perhaps a very strong headache, but there are some headaches that can be the symptom of a potential ictus. So, of course, a stroke is severe and you have to run to hospital. So if the tool detects that you might be experiencing a severe symptomatology, a risky symptomatology, there is an alarm that is immediately raised so that you can be as efficient as possible in your next steps. Perhaps it will even recommend you to run to hospital, right? So it is, I believe, a very efficient tool. The pre-evaluation tool is very interesting. The tool allows you to have a very easy to use and quick access to a health service, high quality health service. Pilar, if you allow, I would like to underline something here. It's very important. This pillar based on speciality is very important. Specialist doctors, the fact that an employer can provide access to all their workers to a wide catalog of specialist doctors is of an extremely added value. Sometimes it's very difficult to have an appointment with a dermatologist. Sometimes it takes days or even weeks, whereas here we have an unlimited access to a long catalog of specialist doctors remotely. We also believe that it's very important to focus on healthcare, but also psychological and physical well-being. We have been experiencing a great deal of anxiety and stress, and as a result of that, there has been a worsening of our quality of life. Perhaps our food patterns or our nourishment patterns have worsened, and that's why the service is or includes also 3 extra solutions which are very important. The first one is psychological support. We have a long list of psychologists, an excellent pool of psychologists that will respond to our everyday life concerns. Sometimes we have no time to go to the psychologist. Perhaps we are experiencing job anxiety, problems at home, or with a teenager son or daughter. So we have here a long list of excellent professionals, highly experienced professionals that will be able to also deal with your online consultation in a very professional way. This is another service that, combined with the previous, is amazing. We also have a nutritional support tool. with the support of a team of nutrition specialists, which will respond to all your concerns, doubts, food allergies, food intolerances, etc. Or even if you experience none of those, you might have the will to manage your diet with the support of a professional. Because oftentimes our professionals ends up being Googling information with no professional criteria. So here we have a team that will assess you personally. And then there is another, of course, fitness online tool, Get Fit. It's called Get Fit, with the support of the nutrition specialist that will offer a special diet for you, for users, through an online form, depending on your activity patterns, depending on whether you are a very sedentaristic person or not, and according to your allergies, etc. Well, nutritionist will come up with a fine-tuned, personalized diet for you, for its users, and you will also have the opportunity of being in touch with them at all times and not being alone in the process of losing weight. Here we have achieved amazing milestones. 4 to 6% of users, all users lose up to 4 or 6% of their weight, which is amazing. Absolutely, Pilar. I believe it's very important to underline how amazing Ponte in Forma Get Fit is. Let me go back to the first slide that you have shared. You said that we have all gained weight as a result of the pandemic. There's more depression problems, etc. So beyond medical problems, which of course, up to date, health and well-being go hand in hand. But it's very important to also provide psychological support, nutritional support. And I believe that is an added value. In the context that we're experiencing, in the post-pandemic context, this is of a great added value. Everywhere, there's a public debate about how the pandemic is having an impact on mental health, so it's very important to have access to this online psychological support service. I would like to refer to communication also, briefly. One of the main concerns that companies show when they hire the service is the following. They say, well, we're going to invest in our professionals. So the concern they have is, well, is it going to be used by our workers? Of course, when a company invests in their employees, it's because they want them to be happier, healthier, but also more productive. So both from Teladoc and Telefónica, because we're one only team, we have a marketing department that issues excellent marketing materials, posters, flyers, emails, personalized newsletters, so that there is a package offered to the company to send the impacts to their workers so that the use of the service is granted. So we're running short of time, so let me leave some time for Q&A in case you have any question. So let me give you the last few figures. We don't want to conclude this session or close the session without sharing some figures about the benefits of Movistar Salud. We have already listed a few of these benefits, but let me insist on a few more. The first one that I believe to be extremely illustrative about how paradigmatic the service is that it really helps improving everyday life, personal agendas. It has been proved, because we have carried out a survey amongst our users, that 75% of service users after the medical interaction decide to stay home instead of going to the health center. That means that 75% of online consultations have been solved online with no further medical interaction. This is an amazing KPI that shows that most face-to-face consultations are not necessary. The program is extremely well valued. 87% of users consider that the service improves their quality of time. That is from the employer's point of view. Let's check at things from the company's perspective. churn is reduced by 51% when we introduce health and support measures. Absenteeism, a very important problem for companies. Such programs contribute to a reduction of absenteeism up to 50%, and this turns into an amazing increase in terms of productivity. Now, let's focus not only on absenteeism but also on talent attraction and retention, the emotional salary that we were commenting before. 74% of workers consider such programs to be extremely attractive. They consider that it's very relevant to have a prevention program. They do not only check the real economic salary, but rather the emotional salary. Mark, would you like to say a little bit more about how users experience the service? Well, as you said before, 75% of consultations end up there online, and here we have some comments and comments about and feedback. It's very important to underline here that even if this is a digital tool, even if this is an online tool, at the end of the day, there's a human team behind, right? Doctors that combine online work with face-to-face. So we consider that it's very interesting to read some of this feedback. As you can see here, it's quite rewarding to see the amazing impact that we can have on individuals thanks to a service of this nature. I believe that we are receiving some questions. Pilar, there's a question which is there any penalty for users that use the service intensively? No penalty at all. As Mark said at the beginning, the service can be used with no limitation at all. It can be used as intensively as needed with no price increase resulting from intensive use. So, of course, when a user needs it intensively, no problem. There's no use limit. We want the platform or the application to cover all health needs with no concerns, with no worries. We have another question, which is the following. Mark, how about tests? Can tests be prescribed online? Well, as I said before, we are members of a platform where we can issue online prescriptions for all Spanish drugstores. Again, let me insist on that, 100% online, valid in all drugstores. It's important to underline that our doctors, as I said at the beginning, they all work in Spain and they all were trained in Spain. So they can also prescribe any medical test whenever the doctor considers it appropriate. But yes, it's possible, both drugs and tests. So we got to the end of the presentation. Thank you very much for the presentation, Mark. Thank you very much for being here. And once again, pleased to have the opportunity to have had the chance to share this time with you. Thank you very much. See you very soon.